In this video, I want to show you the exact way that we actually design, develop, and progress a program for our own clients. A lot of lifters think that the specific injury or like diagnosis that they have, so shoulder impingement, L5S1 disc herniation, all these like labels that they're given for their diagnosis, that's what determines their rehab plan. And in reality, that's just not the case. The three things that we actually use to design and progress somebody's rehab program is their injury history, their specific limitations or deficits, and their training goals. Those three things are very unique to each individual lifter who's dealing with an injury and can be very different across people who have the same injury. So that's why we actually use those three things to influence how we design and progress somebody's program. I've worked with many lifters who have the diagnosis of an L5S1 disc herniation or disc bulge. And due to these factors that are all different between them, they require very different rehab plans. You can't just give somebody with a diagnosis the same rehab plan as every other people with that diagnosis because it's just not going to work well for them. So again, the three main things that we use to design and develop programs are the injury history, their specific limitations and deficits, and their training goals. And that's what we're going to cover, specifically kind of break down each of those three factors for this client. And then I'll show you how I actually took those things and use that to develop the first week of his program. And we'll also kind of touch on how I plan to progress his program based on how he's responding. So the first thing is when we go through the assessment process, we always do a much more thorough interview process to find out all of these things. So this lifter, he's a power lifter, and he basically found himself dealing with a pretty sudden onset of low back pain. About a year and a half ago or so, he was deadlifting. He felt a pop in his back, immediate left-sided back pain, and the pain actually started radiating or traveling down his legs shortly afterwards. After that kind of initial onset, he obviously stopped lifting for that day. And then over the course of the next couple of weeks, he like really heavily modified what he was doing. He really wasn't training much during that time. And he found that the really acute pain started to subside. But even though the acute pain started to subside, he was still dealing with a pretty long-term, lower-level chronic back pain and still a little bit of symptoms down the leg. So because of that, he ended up going to a local PT clinic for rehab help. And this was just what his doctor and a bunch of his like friends and family told him to do. So that's kind of the route that he took. And unfortunately, he had a very similar experience as a lot of lifters do, and a lot of people that we have worked with have had when going to a traditional PT clinic, in that the rehab plans are very, very cookie cutter and low level. It's typically the same sort of like planks, clamshells, bird dogs, dead bugs, and they never really like progressed over time. So they just end up doing the same thing for week after week, month after month, with minimal to no progress. And most physical therapists, unfortunately, just don't know enough about actual strength training or powerlifting training or weightlifting training to provide really good training modification advice or training help. So they just end up telling lifters to just stop lifting or just avoid things that hurt, take it easy, stuff like that. Kind of like very vague, generic advice that's not actually really helpful that you can like implement with a lot of confidence. And that's what this client found. His physical therapist just told him to stop lifting and just do the really easy like rehab work that he recommended for him. When we started working together, he had tried that physical therapy for several months, didn't really see a ton of progress. And after that, he tried just kind of taking care of it on his own because he had such a bad experience with PT. He figured that all PT was the same. So he was dealing with this for like a year after that PT experience and just still making minimal to no progress. He was able to get back into lifting a little bit, but when he reached out to us and we did this assessment, he was really only able to squat up to about 185 pounds before his back pain really flared up and he just couldn't squat anymore. And his prior 1 rep max was about 385, so that was quite a bit lower. And then for deadlifting, he could deadlift from the floor up to like 2 plates, and his previous best was 425. So again, about half of what he was doing before. So really kind of low level training for his prior training experience. And that was really frustrating. So he wanted some actual help that's rehab help that is actually geared towards and effective for lifters. So When we were going through his assessment process, we kind of talked about that history in a lot more detail. And then we discussed his training schedule. So he trained for kind of 4 main training sessions per week, typically Monday, Tuesday, Thursday, Friday. He would squat and deadlift twice each week, and then he would bench 3 times per week. That's just what worked well for him and what he liked to do. So that's how we said we were going to set up his overall program. And then aside from that, we also added 2 more like rehab or mobility sessions per week on Wednesday and Saturday. On Wednesday to give him a little bit of a break in the middle of his training week, and then on Saturday just to have him take Sundays fully off, which is what fit well for his lifestyle. He trained at a full powerlifting gym, so it was very well equipped. Barbells, plates, a bunch of specialty bars, a lot of machine access, kettlebells, dumbbells, all the sort of stuff that you would want to train with. And he was a pretty experienced lifter. He had been lifting very consistently for about 10 years. And in the past 3 years prior to his injury, he had really gotten into powerlifting specifically. So that's how he wanted to train and what he wanted to get back to. And through talking with him in the interview, he was really proficient with like RPE, reps in reserve, tempo prescription, stuff like that. And that's really important because that's how we often program, using specific tempo, specific RPEs or reps in reserve to really tailor how intense the session should be. So he was already very familiar with that, so we didn't have to go into a lot of education about that. But when we work with clients, who don't really know those training principles, they make sure that we do a lot of education to like get them up to speed on what those principles are and how to use them effectively in the training and rehab process. For his preferences, he really liked, for the kind of main competition lifts, squat, bench, deadlift, he liked doing a heavier top set and then having several lighter back off sets for his kind of main barbell training. And then he also liked to include a moderate amount of like hypertrophy type of accessory training, because while he was primarily powerlifter, he wasn't like an elite level powerlifter. He wasn't doing it to like try to get to the highest levels of powerlifting. He loved the power lifts. He loved training for strength, but he also wanted to like train for size and aesthetics too. So he wanted a good amount of hypertrophy work. So we made sure that we incorporate that into his program as well. And also he just wanted to have some movements in the program that made him feel like he was moving well, kind of feeling better. It was kind of like longevity sort of focused as well at the same time. And for his goals, whenever we're working with a new client, we always like to iron out a couple of goals, a little bit more short-term, kind of medium-term, by like the middle of the time of us working together, and then long-term, which is kind of like the end goal that we want to get back to by the end of the initial program. So for him, short-term goal is he wanted to get back to squatting and deadlifting around 300 pounds or a little bit more without really any pain, so like minimal to no pain. For his medium-term goal, he wanted to actually like train for and compete in his first powerlifting meet, and that's what he was doing prior to the onset of his pain. He was actually in the middle of training for a meet that was going to be his first powerlifting meet, and then the back injury happened. So he definitely wanted to get back there and compete for the first time, just see how he liked it. And for his long-term goals, he really wanted to hit some PRs in squat, bench, and deadlift. He specifically said he wanted to hit 405 squat, 315 bench, 495 deadlift. So kind of like the 3-4-5 plate setup that a lot of people have for their goals when they get into powerlifting like this. So that was kind of how we discussed his injury history and like the logistical side of his program. So we knew how to set everything up from a broad kind of perspective. And then from there, we took him through the actual movement assessment part. And the movement assessments that we do with the clients come down to kind of like 2 main parts. The first is a flexibility and mobility assessment that we take them through on camera during their assessment call. And then the second part is more of like a strength, endurance, stability assessment that we have our clients do off of the call. So how we do that side is we make a Google sheet for them that has all of the tests that we want them to do. The tests have like a little hyperlinked video demonstration so they can actually see what tests they're doing. And then they have an area to input their results. This way we can actually look at and assess things like low back endurance, hip strength in a bunch of different planes of motion, all this sort of stuff, and any other like performance factors that we want to get an idea of to see how we should program his actual rehab work and his training to some extent. So for him, the main limitations that we found in his like flexibility and mobility assessment was primarily some limitations in like lat flexibility, so that affected his overhead position and external rotation to like grab onto a low bar squat. A little bit of limitations into internal rotation as well. He definitely had some limitations in thoracic spine rotation, lumbar spine flexion, which is just that like rounding kind of bending forward position. It also is noted that he seemed to be primarily limited by pain with lumbar flexion. So I don't think he actually had like true like muscle tightness or anything that was like limiting his range. It was more so painful. So it's also something that we need to address, but probably not a really big factor in like contributing to his initial injury. And then also hip range of motion was limited into internal rotation, which is one that's very often limited when we work with clients with back pain, as well as abduction, and then for ankle dorsiflexion. So we knew that we wanted to take all those movements and work on his flexibility and mobility because they may be a contributing factor to his injury. And we kind of put a bigger focus on some areas such as the thoracic spine rotation, hip internal rotation, and ankle dorsiflexion, because we felt like those were impacting his positioning during his training the most. So we wanted to make sure that we had the majority of our flexibility and mobility work aimed at those specific limitations. And then for his performance testing, this is the testing sheet that we made up for him. So we had him do 6 different tests, a single leg hip thrust 10 rep max to look at posterior chain performance, mainly like endurance. We couldn't load a lot of these movements up too severely or too significantly because his pain was still pretty irritable, so it would get like flared up pretty quick. So we still wanted to get an assessment of what his like strength and endurance and all that was like, but without causing as significant of a flare up as we could. So we kept most things more endurance focused and like lower intensity focused initially. And then when we reassess later, we'll probably start to add a little bit more load to these tests. So single hip thrust 10 rep max. Then we did a Copenhagen and reverse Copenhagen AMRAP to look at his hip abductor and adductor endurance. A Sorensen hold endurance test, which is just getting on a GHD and holding a completely neutral spine position. And you hold that position until you start to like sag your back down towards the floor. Then we did a hip flexor sit-up endurance test, and then a Powerlifter endurance test for some like rotational core assessment. And really what we found with his assessment is a pretty common pattern. So again, his back pain was left-sided. And as you can see on the sheet, pretty much all of the tests that were testing left versus right had limitations in the left side performance compared to the right side. And that's very standard with this sort of injury. That's a very common finding. And it's very likely kind of like a combination issue where the pain's on that side, so he also might not be as comfortable pushing that side as hard, so that might be kind of limiting the findings a little bit. And he also likely had some weakness in these areas because of that avoidance of pushing those areas to work harder, especially if he was trying to get back into like bilateral movements like leg press, squats, deadlifts, RDLs, things like that. And then for his Sorensen hold endurance test, this is like a staple test that we do with most of our clients with back pain because it's a really good direct measure of low back endurance. And you can see here that he was only able to hold that position for 47 seconds before he started to kind of like curl down or like lose that position. And that also was the onset of pain as well. So he was able to hit 47 seconds. Ideally, what we want our clients to aim for is a 3-minute long hold without losing position. And that's something that we kind of like track and reassess over time as we move on in the program to make sure that we're actually making progress. So this was his performance testing, and this combined with the mobility testing, his goals, and what we learned about his injury and his schedule and all that sort of stuff, that's really what guided how we designed the first week of the program. And then how he responds to that first week and subsequent weeks is going to affect how we progress things over time and change his program and all that sort of stuff. That way we can make sure that we're tailoring it as best we can to what works the best for him and is the most effective for him, but also what he's enjoying the most too. Because while this is a program that like we design and implement for our clients, it is very much a collaborative process where all of our clients have a say in the program. If they want to include anything in the program, we find a way to include it. Their specific preferences and likes and dislikes also heavily shape kind of how we implement a program and progress it over time as well. And with that being said, here is the actual first week of the first train block that we designed for this client. So as you can see here, it's 4 main training days on Monday, Tuesday, Thursday, Friday, 2 rehab or mobility days on Wednesday, Saturday. And I'll talk through kind of each day one by one so you can actually see our thought process behind it. That being said, like each of the 4 main training days start off with a little kind of like a movement prep or like rehab, prehab type movement series where we take 3 drills that are based on what we saw in either the flexibility and mobility assessment or the performance assessment, and we implement those 3 drills based upon their specific limitations. So for this client, we had a lot of like hip mobility work, a lot of trunk and posterior chain work, and then a little bit of like shoulder flexibility, mobility, and kind of like accessory work as well, just to prep him for the upper body training. So from there, kind of going into day 1, we started with his like primary squat was a 303 box squat for sets of 8 to 10 at 3 to 4 reps in reserve. And the reason why we chose this is we had higher rep range, higher reps in reserve, and a slower tempo, all which are going to limit how much weight he can put on the bar for that rep range, and therefore have a lot less likely of a chance to flare up his back. And we also chose a box squat to limit his depth. We're starting him off like squatting to above parallel, and then over time, as his back tolerates squatting better, we'll slowly work that box height down. And we'll also slowly work the tempo down over time, the rep range down over time, and the reps in reserve down over time, so that we're funneling towards like higher intensity training that's more specific to powerlifting. From there, we move on to his primary bench, which just is a competition bench press. With this, because the upper body training really hasn't been affected by his back pain, we're using that top set at a higher intensity with lower intensity back offset structure. So for this first block, we're building up to a top set 5 with 2 to 3 reps in reserve. Then we're taking 10% of that bar weight off and then doing 2 more sets of 5, focusing on really accelerating the bar hard, using a lot of like power and moving the bar as fast and effectively as possible. And then with a lot of these movements, we often use supersets either as a way to like condense the training to make it more time efficient or to sneak a little bit extra rehab work in. So we have this thread the needle to work on his thoracic spine flexibility at the same time as he's also benching too. From there, we had his like a secondary hinge. So we did a single leg hip thrust. Hip thrusts tend to be tolerated pretty well by the back, and making a single leg allows him to attack the posterior chain harder while limiting the amount of like load and stress on the back at the same time. And similar to the box squat, we're using slightly higher reps per set and a slightly higher reps in reserve as well. Pair that with some like ankle dorsiflexion mobility work. And then we ended with a little bit of accessory work that's more so focused on like hypertrophy of accessory areas. So chest support dumbbell row, seated dumbbell curl, both for like lower reps in reserve sets so they can take them closer to failure. And we have them do some RKC planks at the end for a little bit of anterior core work. Moving on to day 2, this is more of like a hinge and like overhead kind of pressing day. So for the hinge on this day, we did a 303 kickstand RDL. So we're using, again, higher reps per set, higher reps in reserve per set, slower tempo. All those are going to limit the amount of weight that he can lift, as well as using the kickstand variation, which is kind of like a single leg variation that's supported. So we're able to train the legs a little bit harder while minimizing stress on the back. We pair that with a kettlebell dead bug for a little bit more core work at the same time. And then we move on to more of his like pressing and accessory work. So seated dumbbell strict press, lower reps in reserve just because he can train a little bit harder. And then seated hip adduction to work on his adductor strength. And then from there, just like day 1, we kind of move into some more hypertrophy accessory work. So lat pull downs for upper body pulling, seated hamstring curl to train his hamstrings a little bit harder, and then some tricep and calf work. On day 3, so Thursday, it's again another squat and bench day. So we had him do a belt squat for this day because a belt squat's a great way to still train the squat pattern and really allow you to hit the legs really hard and keep up or progress your leg strength while pretty much having almost no load on the back because of the placement of the load through the belt. So because of that, we're doing that top set, back offset sort of structure. And then we're doing the same thing with his benching. top set 5, a couple back off sets of 5 with lower intensity loads, and we're doing a 2-second pause. That way we can make it just a little bit different from his first bench session on Monday, and just kind of like control or manage training load for pressing a little bit more effectively. Pair that with a band cat camel to work on some like spine mobility, and then we moved on to his like more accessory hypertrophy type work. So deficit reverse lunge to allow him to train quads a little bit harder, some suitcase holds for some direct oblique work, and then seated machine rows, seated dumbbell curls, and leg extensions to hit the upper back, biceps, and quads a little bit closer to failure with a more hypertrophy focus. And then on Friday, his last training day, this was his kind of secondary deadlift or secondary hinge, and then his last bench of the week. So we did a 303 rack deadlift for sets of 8 to 10, and 3 to 4 reps in reserve. As you'll notice, a very common pattern. We're using slow tempos, higher reps, and higher reps in reserve to limit load on the bar. And then we're using the rack deadlift variation to limit the range of motion for the lift. Because for a lot of our clients with back pain, especially for like hinging, the more parallel you get to the floor with your back, the more stress there is on the back, and it's usually not tolerated as well. So limiting that range of motion by using or by pulling from the rack helps us avoid that position and then slowly work back to it over time. With that, we paired it with a split stance powerlift press to work on a little bit more core endurance, core performance. And then for the bench on this day, we're still using the top set, back offset structure. But because we already benched twice that week, we wanted to pull back on the intensity a little bit more. So we did a 4-2-0 bench. So he does a 4-second eccentric, a 2-second pause, and then a regular speed concentric. And using a slow eccentric plus a pause is going to force him to use a little bit less weight than using like just a pause or just a slow eccentric. So this is just another way that we're managing training load as we're starting into this program. And then based on how his like bench performance goes and how his shoulders and elbows feel and all that, we might push the intensity of benching a little bit more, maybe include a little bit more or a little bit less of like modifications on the second and third bench sessions. It all depends upon how things go. With that, we pair with a seated hip abduction to work on his abductors a little bit more. And then we finish that off with some more accessory hypertrophy work. Single arm lat cable row, another hip thrust with a little bit higher rep range than before, and then some tricep and calf work as well. So that's kind of an overview of his 4 main training sessions. And then the 2 rehab or mobility sessions are again on Wednesday and Saturday, just to break up his training a little bit throughout the week. And I initially had him do the same kind of rehab mobility work on both those days, just give him a little bit more consistency and exposure to those movements. So we're doing a slower tempo seated Jefferson curl to get his low back used to moving into that like flex position, because that's what typically aggravates his back. So a big part of what we're going to do with his rehab work is get his back used to handling that type of stress or that type of like positional demand, and then progress it over time. So we'll start off with seated Jefferson curls, and then we might go to like a wall supported Jefferson curl, and then just a freestanding Jefferson curl. And over time, monitor his progress with that and his tolerance to that position, and add load, reduce the tempo, change up the rep range, all that sort of stuff. And we have some hip mobility work, some direct lat mobility work, some kettlebell hip airplanes, which are a great sort of like accessory hip work because they allow you to work on range of motion and like strength and endurance of the hips at the same time. And then a side plank pal raise, which is a really good accessory or rehab type movement that I like to use with some of my powerlifting clients because it gives you a little bit of like hip and core demand as well as working on shoulder stability and performance at the same time too. So that's how we set up his first training week. As we go through this, we actually write the program 1 week at a time. So as we go through this first block, we'll be writing the program each week, adjusting the volume, intensity, exercise variation based on how he responds, and then kind of repeating that same process over time throughout his subsequent training blocks. He'll be working with us for an initial like 6-month period. So we'll do 6 blocks together. And then from there, we'll see if he needs a little bit more time or if he's good to like go off on his own or follow a different program or that sort of thing. And the goal, especially for like the box squats and the rack deadlifts, is to slowly progress the tempo of the lifts back to just regular tempo, the like rep range of the lifts to mimic more the demands of powerlifting. So slowly working down to single rep efforts for each set, ramping down the reps on reserve for each set so we can use higher intensities, higher loading, and changing the variation over time to get it more towards the competition standards for that lift. So going from box squats above parallel to box squats at parallel to below, and then just to like regular low bar back squats. And then for the rack deadlifts, working the range of motion down over time until it's just conventional pulling from the floor. And that's just an overview of kind of how we figure out how to program for someone, how we actually like implement it and progress it over time. And that's ultimately at the end of the day, like what will get you back to lifting if return to barbell training's their goal after dealing with an injury. You need a plan that blends the lifting that you want to be doing with rehab work that's individualized and progressive for you so that you can work on your like training tolerance, which is what's missing in so much physical therapy, but also have a rehab plan that truly attacks your specific limitations or issues and progresses over time so that you continue making progress outside just that initial progress you might see with a lower level kind of like cookie cutter rehab plan. So if that's something that you're interested in, if you want or are looking for a plan that's very lifting focused and individualized to you, and you know you need help developing one, then just kind of click the link below and request a phone consultation with me and my team, and we'll see if we can help you out. And if you have any questions about this process or like any questions about this case in particular or how we structure like similar injuries or anything like that, then just leave that in the comments below.